Welcome to our Pathoohysiology crash course lecture. Today our topic is Tetralogy of Fallot, the most common cyanotic defect, cardiomyopathy. Before looking into the heart, let's first focus on the underlined word. What does the word cyanotic mean? It's actually derived from the word cyanosis, indicating the blue discoloration of skin, and usually appears during hypoxemia, where the body is under low oxygen saturation. So cyanotic defect just means that this disease will cause cyanosis. And the exact underlying reason of why this specific case is cyanotic will be explained shortly in the next part. First, looking at the clinical picture, let's see what the four heart defects are respectively. Firstly, pulmonary stenosis, indicating increased stiffness and thickness of the subvalvular region. Next, there's also a ventricular septal defect, VSD, where the septum is not fully developed and left a hole in between the two ventricles. The third condition is right ventricular hypertrophy, RVH, simply meaning the thickening of the right ventricle wall. Last but not least, dextroposition, also known as aortic saddle, occurs when the aorta is being in the middle of septum between both ventricles. Coming back to the question, why is tetralogy of Fallot a cyanotic defect? The main problem in this condition is that the narrowed pulmonary artery restricts the amount of blood flowing through it. As we all know, normally the pressure in the right heart is lower than the left side, but since there's resistance in the pulmonary artery, the pressure in the right ventricle becomes abnormally high. As a compensatory response, the deoxygenated blood gets pushed from the right into the left ventricle and flows into the aorta. The dextroposition aorta also receives some blood directly from the right ventricle, thus oxygenated blood originally within the aorta gets mixed with the deoxygenated blood. As a result, the oxygen saturation in the circulating blood decreases below the normal value, and the baby's skin and nails appears to be cyanotic, indicating the lack of oxygen. Next, moving on to signs and symptoms exhibited by those TOF patients. Almost all patients exhibit some of the common congenital heart disease symptoms. For instance, difficulty feeding or failure of the infant to gain weight. But the most significant sign special for TOF patients is the TET spell, in which that cyanosis appears more noticeable during feeding, crying, and defecation of the infant. This is a very important thing to remember. Also, less commonly, it may even lead to fainting or sudden death once the disease has processed into more severe cases. Then, looking at the risk factors of developing TOF. First of all, the common CHD causative factors, such as infection of rubella virus of the mother, alcohol abuse, gestational diabetes mellitus, and etc. But the major concern, apart from those mentioned above, is a genetic disorder called DiGeorge syndrome. The syndrome is caused by a gene deletion on the 22nd chromosome, and symptoms include the abnormal development or even absence of thymus, the parathyroid gland, and of course, heart structure defects. So, DiGeorge syndrome is an important case to rule out. Moving on to the diagnostic tests, the first regular check we should do is to measure oxygen saturation and reveal whether there's hypoxemia. Secondly, a chest X-ray will prompt that the heart is in a boot shape. This is also a very typical sign. ECG might also show some abnormalities, such as arrhythmia or tachycardia. Cardiac catheterization could also be performed. A patient with TOF will have increased blood flow within the aorta, since more blood is pushed into the left ventricle through the VSD. Most importantly, also the key standard of diagnosing TOF is the echocardiogram exam. It allows direct visualization of the VSD, RVH, pulmonary stenosis, and the dextroposition aorta. Lastly, let's talk about the treatments. Starting off with those emergency cases, the most effective and simplest procedure to do is squat, making the knees bending and touching the chest. During this process, the femoral artery on the thigh is being squeezed, and the blood flow in body circulation is not unhindered anymore. The pressure in the aorta rises, and subsequently, blood from the right heart will be more difficult to get in the aorta, thus improves the oxygen saturation of blood in the aorta. Medications could also be given, specifically the beta blockers and morphine, because both of them can help dilate the blood vessels and reduce the severity of pulmonary stenosis. Oxygen supplementation is also important. Apart from first aid measures, surgical intervention is also necessary for a complete recovery. All we do during surgery is to dilate the pulmonary artery or replace the stiff pulmonary valve if the lesion is developed on the valve. Also closing the VSD to block the blood exchange between the two ventricles. So this is all of today's lecture about Tetralogy of Fallot. Hope you like it and find it useful. Thank you for your support.